everyone, so this is me again, Elaine, and then welcome back to my channel. So if you're not yet subscribed to my channel, please click the subscribe button below and don't forget the notification bell as well so that you are informed if I posted new videos. So how your newborn looks? So you have been waiting a long time to meet your baby, and you may notice some differences in how your baby looks compared to other babies you've seen. And that's because newborns look quite a bit different than babies who are a few weeks old. I can show how my newborn looks when um, she was still 1 week. So yeah, it really looks different compared to now. And so how big are full-term newborns? So most newborns weigh between 2,500 to 4,000 grams, or 5 pounds to 8 pounds and 13 ounce. So how does our baby look? So for the skin, it has a slippery white coating called the vernix caseosa. Your baby's skin may be covered with vernix that protected their skin in your uterus. It will be absorbed or is washed off in the first 24 to 48 hours. So if you see a slippery white coating, that's normal, and don't worry about that. It will be washed out. So babies also have white spots, or they call it as milia. And then your baby may have milia around their nose that may last a few months. And these white spots will go away on their own, and don't try to remove them. So they also have lanugo, or the fine downy hair. And your baby may have lanugo on their forehead, ears, and shoulders. And lanugo usually disappears within 2 months. And my baby has that too, and I've noticed there's none now that she's 4 months. And then they have dry or peeling skin. So your baby's skin may be dry and peeling, especially on their hands and feet. That's true. I've noticed that on my baby's feet. And then talk with your healthcare provider about using any creams or lotion on your baby's skin if it's still dry after a few days. So I think I just applied my Dove lotion, and then I didn't worry about it too much. So yeah. And then they also have black or blue marks, which is congenital dermal melanocytosis. And you might see these marks on your baby's body, usually on the lower back or bottom. They look like a bruise, but they're not, and they usually fade in the first or second year of life. And then they also have reddish areas or stork bites, or they call it as hemangiomas. So you may see these areas on your baby's forehead, eyelids, nose, or the back of the neck. And then they usually fade and are gone by the time your child is 3 years old. So that's long, so don't worry about it. But then ask your healthcare provider if you're in doubts. And then continue going along with the how our newborn looks. So for the head and face, they have soft spots, or what we call as the fontanelles. So the anterior, this part here, the anterior soft spot is found on the top of your baby's head, and the posterior fontanelle is at the back of their head. So the bones of your baby's skull have not yet joined, allowing their brain to continue to grow. And the soft spots will join together as your baby gets older. And then gently touching the soft spots will not harm your baby. And then the soft spot near front closes between 6 to 24 months, and the soft spot near the back might be very small and closes between 8 to 12 weeks. So yes, so the the anterior fontanelle closes at 6 to 24 months, and then the posterior fontanelle closes at 8 to 12 weeks. So for the head shape, a few newborns have perfectly shaped heads. It may take up to 6 weeks for your baby's head to become round. So for your baby's eyes may be swollen from the birthing process. So their eyes may be sensitive to bright lights in the first few days, and that's very true even up to now. This is because your baby is used to being in the dark. It's common for their eyes to change color during the first year. Some babies look cross-eyed until about 3 months of age. And if this does not go away as your baby grows, talk with your healthcare provider. And then for your baby's nose may be flat or bruised, and it will return to its normal shape, and the bruising will go away in time. So, and then for your baby's mouth should be pink and moist. So for the body, there are other normal changes you may notice with your baby. So these temporary changes are caused by your baby being exposed to your hormones before birth. And then, so swollen breasts. So your hormones may cause your new male or female baby to have swollen breasts that sometimes leak a milky discharge. Oh, this may last for a couple of weeks. And then baby also has swollen genitals, and if it's male or female, they may have swollen genitals for the first few days. So don't panic, this is normal. And then for vaginal discharge, your female baby may have white, pink, or red discharge from their vagina during the first week.